Morning, good afternoon. Welcome to this third edition of the Lightbeam Voices of Value podcast on LinkedIn Live, in which we'll formally transition to our podcast format. It is indeed an honor for me to welcome our CEO and founder, Pat Klein, to this edition of Voices of Value as our very first visionary guest on the podcast. By way of a brief introduction, Pat is a veteran from the Marine Corps and a very successful entrepreneur who founded NextGen, one of the first and most successful electronic health record companies. Following acquisition of NextGen by Quality Systems and getting it to a very successful place with almost $3 billion in market cap, Pat retired from his role as the President and Chief Strategy Officer of Quality Systems and then went on to found Lightbeam Health Solutions, which, as you well know, is a pioneer, thought, and market leader in value-based care enablement, targeting healthcare providers, payers, accountable care organizations, and MSOs. Pat is an acclaimed healthcare visionary. He sits on multiple boards, and as a certified coach, he mentors senior executives in the area of leadership, teamwork, communication, and performance management. Pat, welcome to Voices of Value. I have to say, I've followed you for a long time and I've been personally inspired by your entrepreneurship and your accomplishments. And it is an honor for me to have you as a very first guest on Voices of Value. So how are you doing today?
I'm doing really well, Andy. Thank you for that introduction. I'm not sure I deserve it, but thank you regardless.
You're very kind and very modest. So without further ado, let us commence our seminal discussion today. So my first question for you, Pat, is, given your stellar success with NextGen Healthcare, what are some of the key drivers and unmet market needs that inspired you to found and create Lightbeam Health Solutions?
First, with respect to the success at NextGen and the success at Lightbeam, well, you characterized it as my success. It's really a team success. I couldn't have done. No one person can do what has been done alone. So we had a great team at NextGen. But to the question, we spent so many years in the EHR industry, getting physicians and caregivers to adopt and collect data, and not a heck of a lot more happened with the data. It was valuable to recall when a patient came back to the practice. The records were there, but we started thinking about what else can we do with this data to really make an impact and improve healthcare in terms of cost and quality. And about the same time, this goes back about 13 years ago, value-based care, wasn't called that then, but value-based care, as it's called today, was starting to become a thing. So we thought, hey, why don't we bring this data to light and do something about it, about the cost and the quality problems that we had. I'll expand a little on the cost problem. The country's in trouble in terms of our debt and financials, and it's something that moves me deeply. You hear about the country being in debt, about $37 trillion at this point. That's a huge number. But what people don't talk about is what the government calls unfunded liabilities. The Medicare system is not called debt. It's called an unfunded liability, but it's underwater just about $80 trillion.
Wow.
The prescription drug program that was put in place under George W. Bush, great program for our seniors, but that's underwater, approaching $20 trillion in addition. Just Medicare and the prescription drug program, before you put cost of ACA in there, which is another $9 trillion or something like that. You're well over $100 trillion, 3 times the national debt. And if you add up the country's unfunded liabilities, which I believe constitutes debt, the Medicare is law. There aren't politicians that are going to put big cuts in place in Medicare. There are somewhere in the neighborhood of 10,000 people a day turning 65 and availing themselves of the Medicare system. So add up all the unfunded liabilities. You have to throw in Social Security, which is underwater about $15 trillion, but you come to almost $1 million per US household, most
Wow.
of which is healthcare. So as we're considering at the time, hey, what can we do with this data? Controlling cost, flattening cost, maybe reducing cost was top of mind, and obviously improving quality while doing so was important. So that was the thought process.
Thank you. That is staggering and sobering at the same time, and obviously lays out a very compelling business case for doing what we do. So my next question, an obvious follow-on, would be: how has Lightbeam Health pioneered solutions and services for value-based care and population health management? And what is the impact on the healthcare industry that you and the Lightbeam team can draw pride from?
I think the Lightbeam team can draw pride from succeeding in the things that we set out to do. So one example is we've through our or with our client partners who have done most of the lifting, but supported by our technology and services, uh, we together have saved hundreds of millions of dollars in healthcare costs. It may be approaching $1 billion at this point. It's hard to know in terms of the commercial savings. Things like the Medicare Shared Savings, MSSP, that's public information and easy to get at, but it's less easy when you're dealing with commercial payers and those contracts. But it's probably approaching $1 billion saved while improving quality. So some of the things that I just talked about with respect to your last question, we've been succeeding at. I think they can also draw pride from being a leader in population health and in controlling costs, reducing costs, improving utilization rates while improving quality. It's a company that has a great mission. Uh, to it's a place where people can make a difference. So very proud of that.
Absolutely. And I must say, I share that pride, and I'm delighted to be here. As a CEO who has not only built very successful enterprise SaaS companies, NextGen and Lightbeam included, but has also led the acquisition and integration of very innovative startups like JVon and CareSignal into Lightbeam. What is your perspective and philosophy on build versus acquire versus partner? How do you approach that?
Well, I think most businesses go through a build versus partner versus buy analysis. There are reasons to build and there are reasons to buy. There's some obvious ones. If you acquire, you get to market faster. Sometimes you can acquire a company that's been 100% focused on a particular technology, whether that's remote patient monitoring or AI, the last couple of acquisitions that we've done. With respect to AI, we actually tried to build and had built some pretty impressive stuff back in 2017, starting in 2017. I think we led that charge as well. We were using available technology at the time,
Mhm.
learning to do predictions on things like undiagnosed diabetics, saying, hey, here's a list of patients that may be diabetic that have not been diagnosed with diabetes, and for the patient's good and for other good, let's identify that. We tried to predict ER visits for certain cohorts of patients, like COPD patients, before those ER visits or ED visits happened. When a stage 3 or stage 4 COPD patient, Medicare patient presents at the emergency room, it's a mandatory admission. And that costs the healthcare system a lot of money, let alone patients not able to breathe. So let's get ahead of that and look at all kinds of factors and let the machine learning, deep learning technology surface some of this. But we weren't moving well enough, fast enough. So a few years later, looked out at the market and looked for the best data science, looked for the best data scientists that we could find, and we found a great company, great data science, great people, and acquired, and we were able to significantly accelerate our solutions and time to market and those kinds of things. And that team's been doing a great job for us. So that's a try to build, fall back to buy, and now we're of course building so much more in the AI world.
Awesome. And we'll talk a little more about that, obviously. But starting from kind of a big picture, 360-degree perspective, what is the impact of artificial intelligence on society and in the healthcare industry thus far? And how is this changing going forward? And I know you spend a lot of time thinking about it. We obviously have very interesting and seminal conversations. So would love to hear your perspective on the impact of AI thus far and how is that changing?
Well, in terms of society and healthcare, I think it's advancing pretty quickly, but on a scale of 1 to 100, I think we might be at a 3. In other words, you ain't seen nothing yet. There will be
Yeah.
huge impacts to society and to healthcare and just about anything we could talk about. The machine learning technology is quite impressive, but Gen AI coming along and becoming a thing several years ago, and now advances in AI agents or agentic AI, that'll just continue. I tell people, if you think you're going to roll up to a Starbucks and be placing your order for your macchiato with a human in a couple of years, you won't be. And if you think in a couple more years, and I'll probably be wrong on the timeline, by the way,
Yeah.
more years, you think that AI agent that you're speaking to at the drive-up window is communicating to a human who's going to make your coffee, you're wrong again. The impacts are tremendous. I'm an old guy, so I lived through several sort of revolutions, the internet being one of them. You think about how the internet changed the world. I think that's a 1 on a 10 scale, and AI might be a 10. Nobody knows, but it's going to be more than we think.
Totally concur with your perspective and your vision, which obviously raises both hope, optimism, as well as trepidation and consternation. So follow up to the question, and we have laid out, as you mentioned, Lightbeam has been working on R&D development innovation with artificial intelligence since 2017. We have that laid out on this slide here. So what are some of these AI-enabled innovations from Lightbeam Health that you are excited about, as well as some of the areas around agentic AI, AI agents, conversational AI, which are happening as we speak? And how will this enable value for our providers, payers, and patients?
So I talked about, Andy, the machine learning, which again, predictions, risk stratification, avoidable things like avoidable ED visits and all-cause readmissions, and to help with so many of those items. On the Gen AI side, we're working on user interface applications. So, for example, simply being able to ask in the English language, create a list of patients or a cohort of patients that are between the ages of X and Y that are that part of this health plan and are overdue for a colonoscopy, and engage those patients directly via phone call or text, and have that sort of essentially being spoken into existence or into action. So the ability to create cohorts and then do something about the insights that these systems surface. Uh, and I guess I'll use the same example leading into agentic AI rather
Mm-hmm.
than phone calling the patient with a very expensive team of care navigators or care coordinators. If we're going to engage patients, we can use AI human sounding voice agents to call those patients, schedule those patients, educate those patients, and those kinds of things. Ambient listening is also evolving very quickly and becoming cost effective. So an application for that might be helping a care coordinator interpret, summarize what the patient might be telling them on the phone, and at the same time going out based on what the patient is saying, based on that situation, and teeing up information for that care coordinator so that call can be as efficient as possible. And in terms of results, again, obvious, higher productivity, lower cost, lower
Mm-hmm.
cost. Again, one of the key things that we're trying to accomplish.
So again, in this era of which is marked by a huge battle for talent, how do you attract top talent to Lightbeam?
I think a company's culture is quite important. We care about our teammates deeply, and I won't go into all of the employee engagement things that we do. Uh, but what I talked about before in terms of making a difference, there are
Mm-hmm.
a ton of businesses where you can really make an impact on so many people. We have the opportunity to make an impact in the quality of life because we can impact quality of care for literally millions of people while doing the right things with respect to cost and utilization, as I talked about before. So it's been relatively easy when a maybe it's a software developer, or maybe it's a client success person, or when they have the opportunity to make an impact and sort of address a higher calling versus going to work for a financial institution or developing software for restaurants to use or what have you.
Mm-hmm.
Again, it's pretty easy. If you're making an impact, recruiting is relatively simple.
As someone who's extremely passionate about healthcare and life sciences, that totally resonates with me. So we'll conclude with this question. We are seeing some pretty astronomical projections of 300 million jobs being displaced by AI over the next 20 years, which could be conservative, and 22 million new jobs being created, which presents a huge disparity. Do these numbers and their implications resonate with you? And what would your advice be to those folks who are vulnerable to being displaced by AI, especially in the healthcare industry? And how do they prepare for this impending scenario?
So how many millions or hundreds of millions of jobs are lost or replaced by AI? How many jobs are created is sort of above my understanding comprehension. But directionally, it sounds right. I talked about the baristas all being out of work and people,
Mhm.
and others, but that'll move to transportation, and just it'll move through all industries between AI and robotics. What will happen in the next 5, 10 years and beyond is crazy and beyond comprehension. To the more important part of the question, because my answer to the first part is I don't really know.
Mhm. Mhm. Mhm.
My advice would be to embrace AI now. Don't have an attitude that I'm not going to embrace AI because AI might replace my job. Have an attitude that if I'm not using AI effectively, somebody who will use AI effectively will replace my job. If I'm in marketing and I'm effectively using AI and I know how to prompt AI to write at twice the speed and develop, whether it's white papers or press releases at in seconds versus perhaps hours, uh, that's quite a talent. And that's what companies are going to be looking for. If I'm a software developer that knows how to set up my projects and do the advanced work and think through it and understands how to best prompt the coding tools, and I can save 90% of the time versus what it would have taken me to manually write X thousand lines of code, I'm going to be in much greater demand than somebody who is not embracing AI. So my advice across the board is get to it, embrace it, learn it, use it as a positive.
Awesome. Sound advice. And on that very positive and uplifting note, which everyone should take heed of, Pat, thank you for your time today. Your time is extremely valuable, and we appreciate it. And look forward to seeing you on another edition of Voices of Value.
Thanks, Andy.
That concludes our session today. We encourage you to follow us on LinkedIn and also check out our webpage and also subscribe to our Beacon blog, where a lot of the thought leadership, the original ideas pertaining to innovation that Pat talked about have been written about, and strongly encourage you to subscribe to the blog, follow us on LinkedIn, and check out our website. Thank you very much. Have a great day and the rest of the week ahead.